I'm Dr. Laura Scmidt. I'm a professor of health policy at the medical school at the University of California, San Francisco. Most experts agree that minorities in the United States generally receive inferior health care. The federal government is clearly interested in reducing these inequalities or disparities in health care. But such efforts are not likely to succeed unless we first improve prevention and treatment for drug and alcohol abuse. For all Americans, not just racial and ethnic minorities, substance abuse is one of the most damaging, difficult, and expensive health problems. We know that minorities and some ethnic groups are disproportionately affected by drug and alcohol problems. What we need to know is how to prevent these problems and treat them. Ethnic groups, by their very nature, have a lot to do with cultural differences. For example, some cultural attitudes towards drinking and drug use can affect the need for treatment. Language can also be a barrier, and so can cultural differences that lead to mistrust or reluctance to seek out treatment. At the same time, there may also be a failure to offer or encourage treatment. A review of the research to date shows that ways of preventing and treating substance abuse problems differ significantly across racial and ethnic groups. In some cases, substance abuse is accompanied by psychiatric problems. This can complicate the services needed by these groups. In some cultures, there's pressure to avoid substance abuse treatment. Others are not willing to acknowledge that there's a need for such treatment. Economic factors can also come into play here. Many ethnic groups do not have access to health insurance. They may be unemployed, and even if they are employed, they may not have insurance coverage for alcohol and drug treatment. Lack of insurance, however, does not completely explain the differences in treatment that ethnic groups receive. Some have health insurance and still don't receive proper care. There's a real need to better understand the challenges faced by ethnic groups in the prevention and treatment of substance abuse. Unless we can understand these problems, we will not be able to reduce disparities in treatment.